So my name is Cheri Nipp. I'm an occupational therapist with North Mississippi Medical Center. And Terry asked me to come and talk a little bit about wearable technology and how it's playing a role for helping those with visual impairment be able to see better. Just to give you a little bit about my background, I graduated with a Bachelors of Science from Occupational Therapy from the University of Alabama in Birmingham in 1990. I completed a graduate certificate in low vision rehab in 2010. I kept going to school for a little bit longer, getting my Master's of Science, and then in 2014 I received a specialty certification in low vision rehab. There's only 2 of us in Mississippi, and there's about a total of 56 of us in the United States, so there's not a whole lot of us that is practicing in this field. This is my grandmother. She's the reason that I chose to pursue this profession. She had a condition called macular degeneration, and macular degeneration made a significant impact on her central vision, so her ability to see up close. And this is my daughter when she was, I think she was 3 in this picture, and she's adopted from Russia, so her eyes are very, very dark. And I knew that that was probably about all my grandmother was able to see of her face was her dark eyes. So her condition inspired me to go back and learn more about low vision. So what is low vision? It is a visual impairment that is severe enough to interfere with our daily activities, but it allows some usable vision, and it can't be corrected with eyeglasses or surgery or any types of medication. So just a few statistics about low vision. Vision impairment significantly increases with age. So around the age of 75 or a little older, about 25% of those people have some type of vision impairment. And it is estimated that a number of those older adults with vision loss is going to increase to about 7.7 million by the year 2030. And what we find with those with low vision is despite multiple disabilities, about 2/3 of these older adults who have low vision are still trying to live by themselves in their own home and being active and carrying out their activities. They have also found that women and minorities make up the people with low vision the most, and the ratio of women to men is about 2 to 1 of those who are still living with low vision. That's basically because women outlive men. So this is what we're finding that's going to occur in the year 2030, which is the baby boomer population. They're expecting the U.S. elderly population to double in size to about 72 million. It is the fastest growing age group, is over the age of 85. About 61 million of those baby boomers will be between the ages of 66 and 84. And what they are finding is that a 65-year-old can average about 19 more years of life. And that's 19 more years of being able to drive and see their grandkids participate in activities and sports and do those activities despite having vision issues. About 85% of those will have at least one chronic health condition, which could be diabetes, it could be hearing loss, or it could be a vision loss. About 62% of those elderly population will have multiple chronic conditions. So they may have low vision paired with arthritis, or they may have low vision paired with a hearing impairment. So what they have found in studies is that when someone has low vision in addition to a chronic disease, then it acts synergistically. It makes a greater impact on their ability to do their daily activities. If they have low vision in combination with depression, then they're more likely to smoke and be overweight, not be very active. If they have low vision in combination with a hearing loss, then they find that those are more likely to have difficulty with daily tasks such as shopping and meal preparation or just managing around the home. If they have low vision in combination with arthritis, then you find that they have limited mobility, which sometimes causes them to have a greater risk of falls, which then increases health challenges related to that. So one of the reasons that having a greater awareness of low vision, especially in the healthcare field, is that these folks are more likely to have injuries related to falls or medication errors. A study in 2008 found that those with low vision have that greater increased risk of hospitalization. In 2009, they found that a large majority of those in the hospital with a hip fracture had some sort of vision impairment. So what we're finding is that a lot of us in the healthcare profession are just missing this. We're not picking up on the challenges related to low vision. So some of the prevalent causes of vision impairment are age-related macular degeneration. There's currently about 1.75 million of those in the U.S., and they're expecting that to increase to around 3 million. Open-angle glaucoma, there's about 2 million, and they're looking at an increase of 3.6 million by the year 2030. And then diabetic retinopathy, about 40% of those who have diabetes have some form of diabetic retinopathy. About 1 in 12 adults who are over the age of 40 with diabetes of around 5 years has some form of diabetic retinopathy, and often it's the kind that's really bad. So just a quick information on normal age-related changes. I'm going to cover some of that for you. So when we get older, our ability to utilize light starts to decrease. The pupil, the little black dot in the center of our eye, gets a little bit smaller. Part of our eye starts to thicken and behind that pupil, and it decreases the amount of light that's coming into our eye in order for us to be able to see better. An 80-year-old person needs about 10 times more light than a 23-year-old person. So it's very important that those who are just older have good light in their home to help decrease that risk of falls. As we age, then we start to lose our ability to see contrast well. Something that is considered high contrast would be like that black keyboard on that white table. That's high contrast. But where contrast becomes a challenge is if you lay a white piece of paper on that table. That becomes low contrast. A 75-year-old needs twice as much contrast as a younger person, and a 90-year-old needs 6 times as much contrast. So again, you start to see challenges in areas like this where there's steps, and the contrast of each step is low. It looks just like the one right below it, so that becomes difficult. Bathrooms are one of the worst areas for poor contrast. Men are the only one who actually needs to be able to see to use the bathroom. So when you have a white commode against a white floor, then that contrast is poor, increasing the risk for falls in that area. As we age, we start to lose our ability to detect color very well. It's caused by part of the eye starting to yellow. The back of the eye becomes less sensitive to color. And then those white objects may kind of look dingy or yellow, which doesn't make a huge impact if you can't match a navy blue sock to a black one. But when you're talking about medication, this is where medication errors can occur if they're taking meds that are yellow versus white versus tan. Often I see patients who get that mixed up. So the other thing that happens is you start needing things like this, which are reading glasses. That's called presbyopia. And we start to lose flexibility in the eye. So when you're looking at a distance or up close, you don't get that movement inside the eye that you need in order to be able to focus. It creates that need for the bifocal. And Benjamin Franklin was the creator of bifocals. I'll just throw that in there for you. The other thing that happens more prevalent in women is we start to have more dryness in our eyes, which can cause blurriness, sometimes itchy or burning. And the only treatment that they really have for that are some of the Restasis and some of the medications that get advertised on television or just off-the-counter tears. Another thing that occurs as we age is we start to have a lot more floaters in our vision, those little black squiggly lines or the little lines if you look up at a light you can see floating by. Those are typically benign. They're not troublesome unless they get a lot more. Or if they're accompanied by flashes of light, then that could signify that there's something more possibly dangerous going on with the eye, or maybe sometimes brain tumors. You can notice some of those things. But it's basically just protein strands or just kind of trash that's floating in the eye, nothing of any significant problems. As we age, we start to have problems with glare. So driving at night may become more difficult because of those floaters. When the light comes in, the light may scatter and kind of create halos in your vision. And then our ability to adapt to changes in light. So going from a dark room out to bright sun or bright sun into a dark room, that can cause issues, especially for elderly who may need to get up and go to the restroom at night. If they have to turn on a light, then it can almost be blinding at times. So I'm just going to touch on the top 4 eye diseases that cause low vision, and these are the ones that I see primarily in my office. The common characteristics of these eye diseases are that they are age-related. The incidence increases with age, and there's about an incidence of 1 in 4 in those who are 80 years and older. The vision loss is permanent. Currently, there's no types of medication or surgeries that can cure these diseases or to return the vision that has been lost. The vision often kind of decreases slowly, so people begin to think that's just because they're getting older, that their eyes are changing, so they don't really understand or realize that there could be a disease process that's happening. The first one we'll talk about is age-related macular degeneration, and I have a simulator here. Cheri, do you want to see that? So this condition causes central vision loss. So the acuity is damaged right in the center part of the vision. The primary cause of low vision is macular degeneration, and this is mostly occurring in Caucasians. The less severe kind can happen in all races equally. The good thing about this condition is that it doesn't create blindness. Someone will never completely lose all of their vision to macular degeneration. The disease process of macular degeneration attacks the cells in the back of the eye, in the retina. There's a part called the macula, and those cells are responsible for us being able to see color and detail. So it's the part of the eye that helps you to distinguish an F from an E or an R from a P. That is the area where you mostly do your reading. So anytime you're looking at something here, it's going to the macula. There's 2 types. There's a wet, which is a more severe type, and a dry, which is less severe. Yes?
What is a macular? What is the where is the macula?
The macula is on the back of the eye, kind of the center on the retina. So you have the retina, which covers the back of the eye, and the center part where everything that comes through your pupil goes directly to the retina, and the detail part goes to the macula. So the macular degeneration causes what we call scotomas, which is a fancy word for blind spots. So it creates holes in the vision. It can also cause a light sensitivity called photophobia. Some patients, that's pretty severe. And it causes the vision to fluctuate. A lot of my patients will say when they wake up in the morning, their vision is better than in the afternoon or evening, so they can see a difference. And then it impacts that ability to adjust to those light changes. So this is normal vision, and y'all got to experience the simulators. This is kind of what it's like to have macular degeneration. So this spot in the center is that blind spot. So when my grandmother in that earlier picture was looking at my daughter's face, she could probably not see any portion of her face, maybe a little bit of the darkness of her eyes. The next condition that I often see is diabetic retinopathy. Diabetic retinopathy is one condition that can cause complete blindness. It's the leading cause of blindness in adults under the age of 65, so it can impact someone in their 20s depending on the severity of their diabetes. The longer someone has diabetes, the more likely they are to have diabetic retinopathy. About 40% of those will have some form of diabetic retinopathy after about 5 years. There's 2 types of this also. There's background diabetic retinopathy and proliferative. The background does not cause as significant a vision impairment as the proliferative. The proliferative, which is the picture to the, I guess your right, the back of the eye has a decrease in the ability to receive good oxygenated blood, so the eye tries to compensate by growing massive little blood vessels, and those blood vessels are very sensitive, so they bleed and hemorrhage. This condition can cause multiple scotomas or blind spots. So there's holes throughout the vision. And sometimes they can actually see a pink tinge of blood that is floating into the eye if that blood reaches the inside of the eye. And this can affect the central part of the vision as well as the peripheral part of the vision. So it can create holes throughout the vision. Difficulty with diabetic retinopathy can impact the ability to check blood sugar, to check their insulin, to draw their insulin, to be able to look at the bottom of the feet for wounds, because a lot of times they lose sensation in the bottom of their feet. The next condition is glaucoma, and I'll go ahead and give that one to you. Glaucoma is a disease of the optic nerve. Open-angle glaucoma is what I see the most in adults. It is a highly genetic condition, so if you have a family member with glaucoma, then your chances of having glaucoma increases. It is caused by a buildup of pressure within the eye. So that pressure starts to increase inside the eye, and it damages the nerve that comes out of the back of the eye. That nerve, once it is damaged, does not repair itself. So it causes someone to lose their peripheral vision. This can also cause blindness. So out of the eye conditions we've talked about so far, glaucoma and diabetic retinopathy can cause someone to go to bed at night and wake up completely blind the next day. So it can take your vision overnight. It has no real symptoms in the early stages, and there's a higher incidence in African Americans than other populations. The risk does increase with family history, and if you have a family history of that, it's something very important to make sure your optometrist knows so they can screen you for it. So it causes a peripheral loss. So your ability, it's like looking through a straw. You saw with the simulator, you lose the ability to see around you, sometimes below you and above you. The other condition is cataracts. Now cataracts in and of itself does not create low vision, because it can be corrected typically. Cataracts, there's many causes. You can have cataracts at birth. You can have trauma to your eyes that can cause cataracts. You can have cataracts, mostly what we see is with aging. The most common cause of age-related vision loss in the world is cataracts. It's found in approximately 50% of people over the ages of 64 to 73. About 70% of those is over the age of 75. This is the most common surgery is cataract surgery that's covered by Medicare. And it has great outcomes. About 90% of those will have some sort of improved vision after surgery. So if you experience that, it's like a general blur or cloudiness of the vision. And then there's the three primary strategies that I use when I'm working with somebody with vision loss is to enhance the visual components of a task. So I may increase the contrast, I may change colors, or sometimes I'll sensory substitute. I will put little bumps, raised dots on their stove so they know where to set it. Or I'll increase the visibility of the task, which is where we're going to talk about the devices that I brought today, is increasing the visibility of the task. So that can include a magnifier, that can include enlarging, but we're going to talk about wearable technology. So just some background on wearable technology. NASA around the 80s developed something called virtual reality in order to train astronauts in simulated environments to get ready to go to the moon. So NASA and the VA and Wilmer Institute joined forces in 1985 and came up with something called the ELVIS. And it's LVES, which meant Low Vision Enhanced System. So they took that virtual reality that they were using to train the astronauts and created something that a person with vision loss could wear in order to try to see better. In the 1994, excuse me, it cost around $5,000, so that was pretty pricey even for back then. So today, some of the usable technology that we have, these are the top contenders: the Jordy, the Iris Vision, eSight, which is here, and MuEyes. eSight was probably one of the earlier contenders that you may be familiar with, and we'll talk about that in just a second. Just one thing that all of the devices have in common is their heaviness. So if you think about a pair of sunglasses weighing about 15 grams, these devices range anywhere from 125 grams, 425 being the heaviest, down to the lowest being 104 grams. So comparing that to a pair of sunglasses, you can kind of see the impact of those. So this is the e-site. It got a lot of attention on the news when a lady was able to see her baby's face. That made a lot of headlines. Today, this device cost just around $10,000. When it first sold, they were charging $15,000 for it, but it has come down $5,000 over the years. Currently, it's sold in 33 countries, and it is a registered medical device with the FDA. What is good about this particular device is that it is custom fitted to the patient and can include their prescription built in as well as their pupil size to help maximize it. For you to qualify to use this, you need about 20/70 vision or worse in your best eye. It does have an autofocus and the magnification up to 24 times. The field of view is a little bit smaller. It's about 37 degrees field of view, but it will connect to Wi-Fi and Bluetooth and HDMI, so you can watch TV or videos inside of them. And all of them, I think, have that capacity. It has a speaker microphone, so you can hear or you can speak into it. It has about 2.5 hours of battery life, but they do have an external pack that you can buy, of course, that adds about 7 hours of use. New Eyes is another device. I'm hoping to have a trial with this. I'm hoping it'll get here this week. That runs about $6,000. It has a 2-year warranty. It's developed, the software inside of it is developed specifically for vision loss. Some of the VAs, the Veterans Administration, is covering this for some of the vets. The battery life is about 1.5 hours, but you can buy external battery pack for 10 extra hours. You can speak to this device, so you can tell it to zoom in or zoom out, so it has the ability to respond to your voice. And also you can watch video and TV inside of it. It has a magnification level about 10 times, but you can add an extra lens that would increase to 12 times. And it can also read text, so anything that you have in front of it, it has the ability to take that text and then read it to you, which is a great option. So the Iris Vision I brought today. I'm going to let y'all play with the Geordie in a second, but this is the Iris Vision. I'll pass it around. It's about $2,500. It uses a Samsung Galaxy phone, so it's based on that virtual reality. But the virtual reality is occurring through a connection in the phone, and you can increase or decrease the magnification. It also comes with a remote, but a lot of patients are using this to help zoom in and zoom out. They are building a lot more, technology into it. It has the ability, I don't have it turned on, Cheri. It has the ability to change color, and it has the ability to add a reading line. So you can zoom in on a specific line in order to blow that up. The camera of this particular Samsung is a 12 megapixel camera. What's good about the Iris Vision is that it has about 70 degrees field of view. So if you're using it, you can see much more of this room compared to some of the others. The pixels of this particular device are 2560 times 1440, which is about 10 times more pixels than the high definition television, so it's very clear. And you can display any internet content, so you can connect the phone to Wi-Fi and you can watch TV or YouTube videos or anything of that nature inside it also. So the Geordie is what I brought and we'll demonstrate today. It's about $36.95. It has about an 8-hour battery life. Now the Geordie's been around for a period of time, but they have upgraded it to make sure they're staying up to date on the technology. And you can attach it to a monitor in order to be able to watch TV and do those things. And then it comes with a stand that you can attach it to, and then you can use it to be able to read under it. So I'm going to turn it on. So this is the control pack. It comes with a little case that they'd have to wear, or they could set it on the table depending on what they're doing. And it kind of has like a cyclops looking eye here. So when you put it on, Terry, this kind of goes at your forehead here. So get there, and then we're gonna, all right, is it on?
Mm-hmm.
Okay, go ahead and stand, watch the score there. All right. So right now, it's looking around the room. I'm gonna zoom in for you. So the reading lens is off. So you see the clock back there? Can you find that clock?
Mm-hmm.
All right, I'm gonna zoom in on that for you.
Oh, man.
It'll take it a second to focus. Isn't that crazy?
You want to try it on?
No, I see it.
I've got it displayed on TV.
Let me look at the door.
All right, so it has a sight, so you can zoom out to order to find what you want to look at. So what do you want to look at?
Look at the door at that elevator door.
All right. Now I'm going to let go of this, and it's going to zoom in. It'll take it a second to catch up with you.
Oh, man.
So the autofocus takes just a second. All right, that's the signs beside the door out by the elevator.
That's pretty wicked.
All right, so it's got a reading lens. I'm going to put the reading lens up for you. Just keep it on. The reading lens on. I'm going to give you something to read. Just stand right there. Hold tight. This is our information from the Lions Club a few weeks ago. Kind of hold that down in front of you. Found it yet? Okay.
Oh, yeah.
So what it can do from there is we can change the color to black and white, white on black.
High contrast.
So just kind of hold it in one place for me. There you go. And then green on black, yellow on black, yellow on blue. So it has multiple color changes, black and white, and then back to color. And then you can zoom in. We'll take it to a second to adjust. And then zoom out.
That is very clear. That is some great stuff.
So you can also watch TV inside of it also. It has the ability to connect to Wi-Fi, to screens in order to view things inside of it. So it doesn't necessarily have to be used for that magnification purpose. And that is the Geordie.
That is pretty revolutionary technology right there.
Oh,
You know, so not many people have seen this stuff.
No, it's making its way. Some of the newer, the Geordie's been around a little bit longer, but they have significantly improved the technology related to that. So just to talk a little bit, you can't talk too much about vision loss without talking about Apple and the iPhone. The newer updates for the iPhone, they now have a built-in magnifier in order to utilize the phone as a magnifier. There's some new apps that have been developed for the iPhone called Seeing AI and then Prismo Go. These are document readers. So for someone who is blind or has significant visual impairment, they have the ability to use their phone to pick up a package and be able to read what's on that package because the phone will read it to them. Seeing AI is a Microsoft developed app and it's free.
Short text.
So right now it's reading short text.
exercise and meet people. St. Church Street, Tupelo, Mississippi. Nearest playground. PMINs possible. Men and or women 10 problem. Pickleball, CKLEBA. Get great exercise and meet and Church Street. Have fun, get great exercise. For arc up.
So it has the ability to read short text. It has the ability to read documents. So it'll take a picture of the entire document. I'll try it and see if it'll do that.
Dust. Document. Hold study. Processing.
Okay.
Pickleball. Have fun, get great exercise and meet new. Where? First Baptist Church, 300. N Church Street, Tupelo, Mississippi.
So it's actually reading the document. It has the ability to take pictures of people and recognize people. It'll do a barcode on a box or something in the grocery store. There's another program called Be My Eyes, which is a volunteer network for people who have vision issues. They can enlist help from people by using the Be My Call app, and it will send out a SOS to volunteers, and it'll connect through FaceTime. So I've been able to help somebody know what they need to cook their shrimp on in the stove, and I've been able to help someone know where to connect a Bluetooth. And then Prismo Go is also another document reader. You need a little bit of vision for Prismo Go, but with seeing AI, you can be completely blind. So if you're interested in the magnifier, you just go to the settings, general accessibility, and there's a place there to turn on and off the magnifier. And then just triple click the home button, and that'll bring up the magnifier. So the magnifier looks like this. You don't have to come in, Jerry, it's fine. And you can increase the size of the text at the bottom and then zoom out. It works well on distance items too, so if you wanted to look at a clock across the room. You can also change the color of that text or freeze the image. This is a picture of a Walmart receipt blown up on magnifier. And then the Seeing AI, we've talked about that a little bit, and then Prismo Go. And then the Be My Eyes app. Just to mention some of the recent technology in treating an eye disease called retinitis pigmentosa, which is also a highly genetic disease, is the bionic eye or the retinal implant. So they're implanting electronic stimulator at the back of the eye. You can see the little black dots there, and then it sends a signal to a camera in order for the person to be able to see shapes and contrast. It doesn't give them their vision back, but someone who is completely blind from retinitis pigmentosa now can start to see where there's an open door in order to be able to navigate, or they can see a contrast in their environment in order to know where to walk. So for someone who's had no vision, this is revolutionary for them to actually have some usable vision. One of the retina doctors that works here in Tupelo is trying to be approved to implant this device, but transmitter antenna is on the glasses, so that little implant on the back of the eye communicates with that in order to help them be able to see shapes and contrast. And that's all I have. Any questions about any of this?
Will you see like an expanse of this technology? I mean, when do you think?
So. I mean, things are already just in the past few years started to advance to lighter weight, more glasses than the heavy things like this. I mean, with the changes in the technology, I think there'll eventually be just a pair of glasses that's going to be small enough to be able to wear to increase that vision. And then the surgery advances in order to have, they're already working on an upgrade for the Argus 2. There was an Argus 1. So they're trying to increase the sharpness of the images for that artificial retina. So they're making advances. Stem cells, I know they're doing a lot with stem cells in order to try to improve on the impact of the diseases of the eye.
Do you think we'll at one point see bionic eyes to the point like where people are born with bad eyes, they can just remove the eyeballs and put in, you know, connect it right there at the stem and have sort of bionic eyes?
I mean, I think that is not too far reaching to think that that could occur. I mean, the optic nerve is the main nerve that communicates our vision to our brain. And right now, you know, when it's damaged, but I think through stem cells, there could be some improvement in that ability to help the retina and the optic nerve to maybe heal itself. But, you know, the artificial retina that they're using, there's no reason in my mind that they could not create a bionic eye that could potentially, you know, help someone be able to see. I don't know. Okay, well, I'm done. Thank you.
Thank you.
Thank you. That was nice. This is a nice price on everything, too.
Thank you for coming.
Yes, ma'am.